much for coming. I'm Mark Levin, Director of the Center for Effective Justice at the Texas Public Policy Foundation. And it's been a while since we had our last primer on criminal justice. It was in December last year that we did one on juvenile justice that I think many of you were at. And but a lot has happened since then. I've actually testified twice before Congress, and I can tell you it's great to be back in Texas where government actually works a little bit. But we've really got a great panel today and a really kind of exciting topic. And really a lot of what we do at the foundation is a matter of aligning the best research, aligning public policy with the best research, making sure that that government processes are incorporating best practices and really what the research tells us works. In this case, to reduce reoffending, to reduce crime, to put people on the path to successful and law-abiding life. And so, you know, in the private sector, there's an incentive, of course, to develop new technologies in terms of hopefully making a profit down the road. In government, it's a little more complicated. Of course, there could sometimes be worries that technologies may displace humans, but what we really find often is rather these technologies enable your limited human resources to be better deployed. And I think we'll hear some of that today. And so we have to make a conscious effort to make sure government is staying up to date when it comes to using the best practices, using modern technological advances. And of course, education, as we've seen with digital and blended learning, is a good example of that. But I think perhaps not enough attention is paid to what we can do in the area of corrections. So I'm very hopeful today we'll provide an opportunity to look at that. And I want to draw your attention to a paper we just released today on this issue, Cutting Edge Corrections, and my colleague Vikrant Reddy, who's here, helped me with this paper, did a wonderful job, so thank you, Vikrant. And we are really pleased to be able to look at how we can come up with some of these ideas and translate them to policies and to the state budget as we look towards next session. So without any further ado, let me go ahead and introduce our first panelist who will make remarks, and of course, as usual, we'll have time for questions after the panel. It's Dr. Andrea Stoller. She's Director of Residency Education and Director of Forensic Psychiatry at Baylor College of Medicine in Houston. She's also Medical Director for the Veterans Court Program at the Dr. DeBakey Veterans Affairs Medical Center in Houston. And with the court system there, of course, she was instrumental in helping to launch the mental health court in Harris County, which I think has been very successful. She was previously a psychiatrist for the Women's Clinic and Center for Sexual Trauma Services in Bay Pines, Florida. And she received her medical degree from Baylor College of Medicine and completed her psychiatric residency at the Baylor College of Medicine on the University of South Florida. So please join me in welcoming Dr. Andrea Stoller.
Thank you. Well, I was told that I'll be the most abstract, so hopefully not too abstract for you. But one of the most effective ways to address public safety, to reduce recidivism and save money is through jail diversion. Programs for offenders whose criminal activity is substantially influenced by treatable mental health conditions. Compulsive behaviors that are driven by addiction or offense behavior that's flowing from psychosis are not effectively curbed or treated through incarceration, although sadly, our state's jails and prisons have become a major source of psychiatric treatment for our mentally ill and our drug-addicted population. In addition to this significant financial burden, this treatment comes at a cost of stigmatization and criminal record, which prevents additional barriers to employment and stable housing that are building blocks of productive citizenship. Psychiatric treatment, even when provided in our prisons and jails, is not helpful once the inmate is released to the community if there isn't ready access to care. Substance use is a very important contributor to offenses for which individuals with mental illness are arrested. Self-medicating with alcohol and drugs is a common way for vulnerable individuals who are suffering from symptoms of depression, post-traumatic stress disorder, or psychosis to manage their distress. And this self-medication leads to addiction and the compulsive behaviors aimed to control the drug cravings, the impaired judgment, the behavioral disinhibition, all of which leads these folks into our criminal justice system. If we can divert these offenders to treatment, it's a win-win for the community with lower cost of community treatment as compared to incarceration plus treatment, and the likelihood that the individual will remain in treatment when the treatment is provided and can be continued in the community. We have effective treatments for mental illness, and substance abuse. Addiction, like other chronic conditions such as diabetes or high blood pressure, is treatable but difficult to cure. Preventative measures to reduce criminal behavior on the front end include expanded access to care and the reductions of barriers to treatment. And effective treatments and functional recovery is possible, but it requires evidence-based psychological and psychopharmacologic treatments that are often not readily available or paid for in the community. At the juncture where it's possible to divert offenders to community-based treatment, it's important for public safety that these treatments are provided in the context of structured oversight to assure compliance. One impediment to recovery is non-adherence to the treatment that is offered. And mental health courts, veterans courts, drug courts, and DUI courts are obviously examples of these sorts of structured programs that provide that oversight. Not only do these courts make sense in terms of reduction in recidivism and in recovery and rehabilitation of the individual, but they're also cost-effective. There was a February 2014 bulletin from the National Institute on Drug Abuse that reported that a California law that allowed qualified drug offenders to enter substance abuse treatment rather than go to jail or prison saved the state close to $100 million in the first year. And this took into account the cost of expanded treatment and found that the major cost savings was in post-conviction incarceration rates. Substance abuse treatment has progressed greatly in recent years with the approval of new drugs and increased understanding of the biological basis of addiction. It's well established that most drugs of abuse directly or indirectly target the brain's reward system. Dopamine is a brain neurotransmitter that regulates emotion, motivations, feelings of pleasure, among other things. And drugs of abuse overstimulate this brain's reward system, and then with repeated drug use, the brain adapts to this overstimulation by reducing the natural production of dopamine or reducing the number of dopamine receptors and thereby dampening one's ability to experience pleasure. This reduced state of dopaminergic activity results in decreased motivation, anhedonia, and with the brain adaptation to chronic drug use, you need more and more to get that same effect. And the cycle persists, with the addicted person turning to illegal activity to support the habit, to avoid the withdrawal, to medicate the dysphoria, and to achieve that ever-elusive high. We are learning more about the biologic characteristics that increase an individual's risk of substance abuse and relapse. For example, just this past week, I attended a conference from bench to bedside about the finding of particular receptors in the brain, a certain part of the brain, the prefrontal cortex, that appears to have a differential balance in receptor activity that predisposes certain vulnerable individuals to addiction. And so as we learn more about the brain and more about the biological basis of addiction, we're better able to target treatments. So examples of effective treatments for substance use, as well as for other psychiatric disorders, include long-acting medications. Monthly injections of a medication increase the likelihood of a compliance and therefore the effectiveness of the medication. Long-acting naltrexone, which is known as Vivitrol, was first approved by the FDA in 2006 for the treatment of alcohol addiction. And more recently, long-acting naltrexone has been approved for opioid addiction based on the findings of research that was mostly done in countries where opioid substitution is not available, like methadone treatment. The long-acting naltrexone has demonstrated effectiveness in reducing cravings and in preventing relapse to drug and alcohol dependence. And currently, naltrexone is the only approved medication for opioid dependence that is not a controlled substance, and it's the only long-acting medication that's available for both opioid and addiction and alcohol dependence. There have been some studies, generally small studies, in the criminal justice system to assess the efficacy of long-acting naltrexone, for example, in DUI offenders, which showed a reduction in the average drinks per day and an increase in the number of abstinent days. There's also a trial in a drug court setting which showed reduced missed court dates, and then there's been a few small studies looking at probation and parolees. Traditionally, however, opioid addiction has been managed by opioid replacement therapy, namely methadone maintenance. There's another drug that is relatively newer, and that is a combination of buprenorphine and naloxone, which is also known as Suboxone. And this provides a safer alternative to methadone for opioid-dependent people. So buprenorphine is what we call a partial agonist, opioid agonist. So as a partial agonist, buprenorphine provides some of the typical opioid benefits like pain control, euphoria, and also the negative side, the respiratory depression. But as a partial agonist, its effects reach a ceiling above which there's no additional benefit, no additional good feelings, and there's also no additional risk. It also has a stronger grip on the receptors in the brain, so if somebody takes a pure agonist like heroin, it'll actually knock it off the receptors and can set somebody into withdrawal. The other half of Suboxone is a drug called Naloxone. Naloxone is the drug that we use to counteract opioid overdoses. When it's taken by mouth, it doesn't have a whole lot of activity. And so Suboxone, which is taken by mouth, has this combination. The naloxone doesn't do very much. But if you crush it and shoot it up, the naloxone has an effect and sets somebody into withdrawal. So therefore, it's an example of a medication that has a lower abuse potential, lower liability as far as risk, and also, as far as the court system, the routine toxicology screens remain negative for opiates, and there's a separate drug screen that you can do to look for the presence of buprenorphine. At Baylor, where I am, we have researchers who are on the cutting edge of addiction research. Dr. Thomas Costin, who's a professor of psychiatry there, is one of the scientists who's working on vaccines against drug addiction. So the anti-drug vaccines use the body's immune system to block the effects of the drug. The vaccine is made up of a carrier protein that stimulates the immune system, and then another molecule that sort of mimics the drug of abuse. And so when somebody uses a drug of abuse, this molecule has provided the basis to stimulate the immune system so that the antibody hangs on to the drug of abuse. It can't get into the brain and have its positive effects. And there are currently studies underway looking at antibodies towards heroin and cocaine, and there's human studies at Baylor on the cocaine vaccine. Unfortunately, however, even with all these advances in addiction treatment, these medications are markedly underutilized. For example, despite the substantial increase in opioid use and deaths from overdose in the past decade, as we've seen in the front page news, less than 40% of Americans with opiate use disorders receive medication-assisted treatment. Another important aspect of substance abuse treatment is monitoring for abstinence. Random drug screens, drug patches, and transdermal alcohol systems, the SCRAM, are examples of mechanisms that enhance accountability. The SCRAM, which is worn as an ankle bracelet, provides 24/7 monitoring for alcohol use. And the SCRAM's Systems Alcohol Monitoring Grant for Veterans Treatment Court has allowed our treatment court, our Veterans Court in Harris County, to utilize this important monitoring device. And I've had some of my patients who've actually requested to have the SCRAM during times of high risk. It's a constant reminder of their recovery. And so we can do a better job in Texas of taking care of our mentally ill and addicted citizens through the use of effective treatments, both pharmacologic and psychological, and the support of community mental health systems to provide this care. And I just have to stop and make a point. My other part of my job is as residency director, and my residents have been called in as alternates the last few days because the Harris County system's psychiatric emergency room has been overflowing with patients. In the last 48 hours, I think we have over 60 psychiatric patients who've come in the door. So we need to have some place to divert these folks to if they're not going to jail. But we can do an awful lot. We have a lot to offer through healthcare. Thank you.
Thank you very much. Our next speaker is Michael Nail. He's Executive Director of the Georgia State Board of Pardons and Paroles. He also serves on the Executive Committee of the Georgia Peace Officer Standards and Training Council and is Chairman of the Probable Cause Committee. He, along with myself, are participating in the 3-year executive session on community supervision at Harvard University's JFK School of Government. Mr. Nail holds a Bachelor of Science degree in criminal justice and a master's degree in public administration, and is a graduate from the Georgia Law Enforcement Command College. Please join me in welcoming Michael Nail.
Thank you. Thank you, Mark, and certainly thank you to the Texas Public Policy Institute. I appreciate the opportunity to be here with you today.
Not you, not worry.
You see, I'm blamed for everything, so this is another continuation. But it is great to be here, and I also want to say thank you to Texas. There are a lot of good things taking place in the state of Georgia on criminal justice reform efforts, and very candidly, a lot of those cues were taken from the work done in Texas. So I wanted to thank you for helping us to get where we are and build upon your success. So I appreciate that. Keeping with the theme of technology and corrections, there are really 3 areas I wanted to just talk with you about briefly this morning. One is our utilization of voice recognition system. The second is utilization of virtual offices. And the third is taking virtual hearings and utilizing technology for that. I've got to tell you one thing, though. While we all want to save money in our business of public safety, if you save money, that's great. But first and foremost, the driver of any initiative has to be enhancement of public safety. Then, if there are cost savings associated, it becomes a win-win. While money is important, it cannot be the driver in and of itself. Certainly is a factor. Just briefly, talking about our voice recognition system, what it is just what it says. It's a call-in system that is 99% accurate on the voice recognition of the voice register. Now, if Georgia would have tried to embark on that through its own means, we would have never gotten there. We recognize the opportunity of partnering with the private sector in this area. Now, I got to tell you, from a criminal justice practitioner stance and well over 25 years in the business, we really are not all that good at letting other people come into our domain. I mean, I'm just being very candid with you. And how this came about, actually, a senator from the state of Georgia said, "Hey, Michael, I think you need to go over and listen to what these guys have to say." And we did, and it was a Georgia-based company, and we really liked what we heard. At the same time, in our clemency side of parole, we were moving towards a completely electronic system, no longer working off of paper files. But we knew that was going to increase our efficiencies, our effectiveness in a release decision-making, so we had to build some capacity with our officers because they, in fact, were going to have more caseloads coming out, more cases coming out to them. That was a concern. You all know as well as I do, the position truck isn't right around the corner. Nobody's just going to come and dump you new positions to handle these new cases. So instead of doing more with less, what we said is we got to find a way to do better with what we have. So we looked at a company called Anytrax out of Georgia, and we said, look, we know what research says. You can, in fact, over-supervise low-level offenders. It sounds kind of crazy, but it's true. So what we needed to do is we needed to target our high-risk offenders. How do we do that? By freeing up our resources of dealing with these low-end offenders. So we formed, if you will, a public-private partnership with Anytrax, and it's been a wonderful relationship. Now, here's the beauty of it. The offender pays for this. Georgia does not pay, and I'll just share some numbers just right off the bat. If we would not have Anytrax in that relationship, we would need 37 additional parole officers on an average caseload of 100. So, as I said, we weren't going to get those positions. We knew that, so we had to find a way to do it better with what we had. The other thing is, right now, Anytrax represents 15% of all parolee supervision. Now, okay, that's great. We're saving money, but is it being effective? It in fact is. Over 10,000 parolees have passed through on Anytrax, and as a result, they have had thus far a 97% success rate. So you can attribute that to any tracks, but I think you can also attribute it to criminogenic needs being addressed, responsivity, those low-risk offenders not being overly supervised. And when you go around, I was joking outside a moment ago, if you want to find out if officers like something or not, you go out there and you ask them, because if they don't, they will be quick to tell you. And routinely we hear a good, positive working relationship with any track. So, number one, the public-private partnership does work, and there are folks that can help supplement the criminal justice arena if you're just willing to reach out and do that. We have Linda Hughes, who's the CEO of AnyTracks here, Louis Hunter with AnyTracks. So I would encourage you afterwards, if you want to talk to them specifically about it. I'm just a criminal justice guy. I don't get into the technology part. All I know is it works. And it works extremely well for us. We're in fact venturing out now into cell tracks. You know, electronic monitoring and GPS has been around for years. Some would argue that it is outdated technology. As a result, we are continuing to expand with AnyTracks and going to a cell tracks program. When over 2/3 of the population have a cell phone, it's become the way of doing business today, and that's not just with law-abiding citizens. Offenders, that's their way of communication. So instead of electronic monitoring and GPS, we now have a cell tracks program that we are embarking on. Although we're early into that phase, we're looking forward to some good outcomes. And oh, by the way, it's an incentive for offenders, because they know that once they go from parole supervision directly with that officer to voice recognition, when they've been on voice recognition a year, they've had no violations, the parole board is more inclined to commute that sentence because they have demonstrated that they can comply with conditions directly under the supervision of the officer, but also through this voice recognition system. So again, very, very successful. Second thing is virtual offices. People thought I lost my mind about 3 years ago when we made the decision we're closing our offices. I can tell you the sky was falling when you said that. But here was the irony. We'd go around throughout the state visiting with parole offices, and you'd look around and nobody was in them. And so you'd ask, where's everybody at? Well, you know what? They were where they should be. They were out in the field doing parole work, visiting offenders in their home, work, community, treatment, exactly where they needed to be. So you got looking, why are we paying for all this square footage in this place and utilities? Made no sense at all. So in fact, in a year's time, we had set a 3-year plan to close all of our offices. Unfortunately, the governor gave us the directive to cut $1.5 million out of our budget. Easy. We're going to take that 3-year plan and we're going to condense it in 1 year. And I got to tell you, hats off to the staff, because they made it happen. Very effective. So again, saving money. Now, I said saving money should never be the driver, and in this case it wasn't. What we found by closing our offices, we increased contacts with offenders by 22%. The other thing is, we found that officers reported spending more time with their offenders and having greater quality interaction with the offenders. Okay? So that made a difference. Our relationships with law enforcement and treatment providers increased substantially because we were out in the field where they were, working alongside them. And the other thing, you know, from the private sector, the worst thing you can do for a salesman is give them an office, right? Because what do we do at our office? We chit-chat, we catch up on the week, we find out what's going on, and quite candidly, we waste a lot of time in the office talking about nothing, when we ought to be using that time out in the community, supervising these parolees and these offenders, working with these treatment providers, networking with law enforcement, working with employers. That's where we should be. So we took the office, closed it down, we put 2 officers in 1 vehicle, but the biggest thing, talking about technology, we advanced on that. All of them had already had laptops, so we were there, but we issued a Droid device. And now we were on Lotus Notes. Now we're in a Google Gov platform. Now Amazon Cloud. It's made all the difference in the world. If you talk to schools now, bring your own technology. In essence, that's the way it is with parole officers in Georgia. They can bring their own technology. Whatever device you are comfortable with using, you can manage your day-to-day work there. And, oh, by the way, we set up a Google number for our secretary who now works from her home and has an office there. So instead of the offender getting released and reporting to the office, they have a number they call, and an appointment is scheduled, and they know this parole officer will be at your home on this date, this time for your orientation. And guess what? Everyone involved in the parolee's life hears the expectations of parole. It's no longer one-on-one with the officer and parolee at the office, who, oh, by the way, he probably had to take a day off work to go and report. So none of that. Here's some things we didn't expect to find that we thought was really impressive. Utilization of sick leave has gone down. Why? I mean, you'd think, what's that have to do with it? Well, when you have an officer that has, and this is a real life example from Hartwell, Georgia, an 8-year-old child that's sick, that they would have had to take sick leave to stay at home with that child, but that officer was able to use that day as their administrative day to catch up on all of their interactions, make contact with referrals and treatment providers, and follow up on work. Otherwise, they would have had to take sick leave and stay home with that child. And they said here they were able to do their work while their child laid on the sofa. So the sick leave has gone down. We've also noticed when you talk about the generation today, the biggest thing that they want is work-life balance. You know as well as I do, I know I did watching my parents. We grew up and we lived to work. Generations now, they work to live. And they want that work-life balance. And they no longer have to say, I can't go to your soccer game because I've got to be here. I can't go see your play because I've got to be here. So they're allowed the flexibility to work, the schedule they need to work to get their job done. And also, offender supervision is not Monday through Friday, 8 to 4:30. The days of fortress probation and fortress parole supervision are long over with. So that's where we are right now when you talk about virtual offices. Finally, video hearings. If in fact a parolee does violate their parole and you take them to a final hearing before the parole board, what was happening, we got 5 different geographic locations at the time, and we're holding these in prisons. Okay? So the parole board member would have to travel to that prison, have the hearing. The parole officers, too, would have to transport that parolee to the prison. So a classic example, if you were holding a revocation hearing at Lee State Prison and they were coming over from Valdosta, 2 officers, that was their day, transporting that offender. By the way, every time you go into a secure facility, you're jeopardizing the safety and security, because any time someone from the outside goes into the facility, it takes more time and resources for them to make sure the proper security protocols are in place. We started thinking about that, going back to the utilization of technology. We said we got to have a better way. Give you an example. Just last week, we had the parole board member in Atlanta, their office. We had the offender at Jackson State Prison, about 60 miles south, and we had the officer as well as a law enforcement officer up northeast in Rome, Georgia, which is about 90 miles, northwest. And we handled that final hearing, and it was as if they were right there through the utilization of video conferencing. So we've saved officers time. Officers now report that towards a final hearing they spend about an hour. Typically it was 4 to 8 hours. They leave, they're able to get right back to their job. Inmates now come to one central prison. They're put on Department of Corrections transport system. Oh, by the way, if you get revoked for parole, you were going to go to Jackson anyway. So why don't we start there and pull them all there? It makes good sense, doesn't it? I'm convinced sometimes logic does work. And in this case it did. So that is one thing. The safety and security to these GDC facilities was no longer an issue. It freed them up to do their core mission responsibility. And the other thing is that is great about it, officer safety. Anytime, the more travel you do, the more custodial situation you have with an offender, your risk of safety goes down and your risk of something bad goes up. So that is one thing we found to be very interesting. In just the first 6 months that we implemented virtual final hearings, we saved 31,000 miles. If we would have continued to have hearings at those 5 locations, we would have had 31,000 miles. Think about the mileage, think about the time cost, and think about the safety when they're on the road with an inmate or an offender. So again, very, very positive things taking place. So I appreciate the opportunity to be here with you today. Again, thank you, Mark, and your organization, wonderful. And thank you for Texas kind of leading the charge. And fortunately, Georgia had good sense to follow Texas and head down the right path. So again, thank you so much for allowing me to be here with you.
Okay, well, speaking of Texas, I think our next speaker is one of the people who deserves a lot of credit for what we've seen in Texas with less recidivism among both our probation and parole populations, and also, of course, the drop in our prison population and crime rate. Carrie Willibob is director of the Texas Department of Criminal Justice Community Justice Assistance Division, and I think, as all of you know, that is the division that gives out the money for our probation departments in Texas. They get about almost half from that, and then the other 53% or so from probation or fees. She's been instrumental in developing evidence-based programming and piloted the first cognitive behavioral program in parole. She's worked on numerous legislative and statewide initiatives, including helping promote and implement the additional diversion funding that we've seen be so successful in Texas, and developing the graduated or progressive sanctions models that probation departments around the state are using. And most recently, rolling out the Ohio risk assessment system, the Texas version, throughout the probation departments in Texas, all 121 of those departments. She holds a Bachelor of Science degree in psychology from Angelo State University and an Master's of Public Affairs specializing in criminal justice from Texas State University. Please join me in welcoming Carrie Willibob.
Thank you, Mark. And I'd also like to thank the Texas Public Policy Foundation for hosting the panel this afternoon and for the luncheon. We really appreciate that. It really brings me great pleasure to talk about some of the things that we're actually doing in Texas. And I guess before I begin, it would be a little bit helpful to maybe put some things into perspective, since you just heard from Mr. Nail and talking about Georgia and the parole system, which is a centralized system in Georgia. In Texas, the probation system is a decentralized system, and we actually have 122 probation departments in the state. We have just a little under 400,000 probationers who are under supervision, supervised by more than 3,300 officers. So again, when we talk about a decentralized system and you look at the district judges and the county court at law judges who are responsible for appointing the 122 chiefs that we have in the state, you're talking about a lot of alpha personalities, who start to come into play when you look at decision makers. And I see some of you smiling because you probably know some of the people that I'm talking about, right? But again, when we're looking at this part of the system, you have to really look at, how can we work to mandate certain things that need to be done at the state level, but also influence local policies so that you can actually have an ultimate effect on the offender behavior, and then ultimately our recidivism rates, so that we can increase public safety and ensure that we have fewer victims in the community. So one of the big things that actually we've been working on for a number of years revolves around our assessment process. Now, we have had an assessment system in place in Texas for more than 30 years. And we started looking at what we were doing and where the rest of the state was going as it related to the research. And why was this important? Because the instrument that we had validated numerous times, did a really good job sorting people into low, medium, and high-risk categories so that officers could do differential supervision based on those categories. So what was lacking? What more did we need? Well, research essentially showed us the criminogenic factors that Mr. Nail was talking about. And what are those? Sometimes you hear that word and people wonder, what does that mean? Well, really it means what are the things that drove that person toward crime? Okay? Why did that person commit the offenses that they did? So it's really important to look at that because sometimes in the criminal justice world, you have some communities that may look at us and think that probation departments can be all things to all people. And we just can't do that. So we have to focus on the things that actually got individuals into the criminal world. So that was one of the big reasons that we started looking at a new assessment model. Because we wanted something that was going to actually give us information on criminogenic risk and needs and how we needed to supervise people in the community. How could we target those things, again, so that criminogenic thinking would go down and public safety would go up? So we started validating a risk needs instrument, which is a fourth generation actuarial instrument, and it came out of Ohio. One of the reasons that we did validate it in Texas, of course, we wanted to be sure that it was normed on our population and that would generalize to our population. And when you look at the Ohio stats and you compare them to Texas, we were comparable in a couple of areas, except when you started to get to the Hispanic population. In Ohio, the Hispanic population was included with the other category, and it was 3%. In Texas, our Hispanic population is 36% by itself, and then we have an other category, okay? So very different populations. And part of the reason that that's important is because I did have a number of chiefs who were very gung-ho, and they were ready to start that assessment now. Let's go now. And then when you explain, no, we actually have to validate it. We have to train people. We're looking at inter-rater reliability. We're trying to make sure that, it's measuring what it's supposed to be measuring. Oh, and yeah, by the way, once we do that, we have to give them at least a year, ideally two, to reoffend so that we can decide, did it work or not, okay? So you can imagine that was just met with open arms, because we're so good at having patience. But we were able to convince people that it was the right thing to do, and we are actually on the tail end now of implementing this project. We have validated the instrument. It was actually very predictive of the Texas population, so much so that we were able to create two instruments, one for the misdemeanor population, one for the felony population. There's a screen that officers do that sorts individuals into a low risk and then to a medium and high. And then they do a full assessment on the medium and high, then to sort again into low, medium, and high. We now have different cutoff scores for the male and female population, whereas before in Texas with our old instrument, we had the same cutoff scores. So really we've been over-supervising the female population for a long time. So now that we have different cutoff scores, we'll be able to target those areas more appropriately with our differing male and female populations. When I'm talking about criminogenic needs, just to let you know how they fell out for the Texas model, we're looking at criminal history, education, employment, and financial situation, family and social support, neighborhood problems, substance abuse, peer associations, and criminal attitudes and behavioral problems. Notice I didn't say mental health. And one of the reasons that I point that out is that sometimes people have this misconception that mental health contributes to criminal behavior, and that's not the truth. There's not a direct link between the two. Instead, what happens is that there are many people who are offenders with mental health issues, but they have more of these criminogenic need areas. That's essentially what happens. So mental health is still an area that we address as it relates to responsivity, how someone is going to respond when they're in treatment, but it's not a criminal domain because mental health does not directly contribute to criminal behavior. So we've continued to do this. Right now we have, again, validated the instrument. We are creating videos. As a matter of fact, we're videotaping today out at the SMART facility at the Travis County Community Supervision and Corrections Department. We will take these videos and then we will finalize our curriculum. We pilot the curriculum essentially then in the state, and then we're going to push everything out in July. Now what was exciting for us in probation is that we started this probably about 7 years ago. I mean, it's been a long road. I think it's been a good road, but it has definitely been a long road. But the rest of the agency also looked at some of the things that we were doing in probation, and then there were recommendations that came from the Sunset Commission that the agency adopt a system-wide assessment process. And so now the rest of the agency has been implementing this assessment. When I first learned about this instrument, one of the things that intrigued me is that the assessment builds on itself. So you have a piece that's in probation. If a person is revoked and they move into the prison system, the assessment follows them into the prison system, follows them into reentry, and then follows them out into parole. Because most of the people who are revoked off of community supervision will eventually come home. You know, it's one of the reasons, though, that we need to break those cycles, and we need to figure out how can we change behavior while people are in the community and make them, you know, tax-paying, productive citizens so that they're not moving into the prison system. Because when people move into the prison system, they don't go alone. Their family goes with them. People from their work go with them. You know, essentially, people from your church. I mean, you don't affect just that one person. There are a lot of peripheral individuals who are affected when someone goes into the prison system. So the exciting thing about this is that we can track how an individual does in each one of those criminogenic need areas, low, medium, and high for each area, and then we can follow them into the system. Now, the legislature actually provided some dedicated funding this last session so that we can automate this system. So not only are we doing this assessment now, we're starting to drive out the assessment system, but the rest of the agency is pushing forward with implementation as well. And then in pretrial, we have a number of probation departments that operate pretrial programs in the state, but most pretrial programs are operated by the counties. But I've had a number of pretrial programs who've approached me to say, how can we get in on this too? Because there's actually a pretrial instrument that is associated with this assessment process. So again, you know, it's very exciting because we can look at individualized differential supervision, again, based on the needs of the offender, low, medium, or high. And again, putting primary resources into your medium and your high-risk offenders and not putting all of this energy into your low-risk population. You know, my auditors, what we've seen is the same thing that Mr. Nail talked about. When they go out and they look at probation departments, oftentimes you will see policies that say, yes, you supervise a low-risk person this much, you supervise a high-risk person this much, and a lot of times we find that we're supervising them pretty much all the same. Why is that? Well, sometimes those high-risk people don't always report, you know, and then sometimes they have real circular thinking, and sometimes they're just not some of the easiest people to talk to. Whereas you got a low-risk person coming in, and they want to tell you about their job, and they want to talk to you about their family, and they're willing to open up about what's happening in their life because they want to get help from you. So guess what? It's easier to have that conversation with that low-risk person. But that's not where we need to have our conversation. So that's why it's so important that we really look at where are our resources, and are we putting our resources toward these criminogenic need areas? Are we able to provide cognitive behavioral programming for the individuals who have cognitive deficits, who, you know, have criminal thinking and think that, you know, because they're walking down the street and the garage door is open and the new riding lawnmower is inside there, I can take it and I'm really doing you a favor because insurance will pay for it. You left your garage door open, and so you probably wanted someone to take it anyway. So, I mean, look, I just benefited you, actually, probably doing a public service. So, you know, that's that criminal thinking. So we're trying to find ways that we can really interrupt that within the state. So then then if you look at it and you start to look at case planning and you look at that low-risk population, some of our departments have kiosk reporting so offenders don't come into the office on a regular basis, but instead it's like a little ATM machine. They go up to the ATM machine and they report that way. So we're using technology that way. In addition, we have been using Skype. We had a demonstration the other day. We have a number of departments in the state that we use Skype for jail visits, and we did an interview with an officer who was in Kuwait, and so he was reporting in by Skype, and so big time change there. But that was really good for some of our departments to see that and to know that they are able to use that kind of technology. In addition to that, we are using, of course, social media now, because it's one way that you can help track sex offenders and start to watch. Yeah, we can tell people not to have certain social media sites, but not everybody's real smart when it comes to that. So, officers will go in and they'll search social media accounts. And all you have to do is start searching a family member, and eventually you can find out if that offender has a site and they're not supposed to have a site. Looking at how can you use social media for risk management. Because when we're talking again about differentiation of offenders into these categories, when you have really high-risk offenders, you actually don't want to mix them with even just high-risk, definitely not low-risk offenders, because essentially think that they will use their influence to change other people's behavior. So sometimes we just have risk management strategies such as GPS, passive or active electronic monitoring, as Dr. Stolen had mentioned, that we use in the state in order to monitor what people are doing. Ignition interlock, of course, for DWI cases. So there are a number of different things that we do. But again, you have to figure out what is the best fit for each individual person, based on, also what their needs are, and then based on what their responsibilities are in the community. Because if you take someone who has a good job and they are a low-risk person, and then you require them to come into the office when they're having to miss work, or you require them to make certain groups where they're having to miss work. I mean, you could actually interrupt a lot of the pro-social things that an individual already has in place. So we have to be really careful about that, and it's a balancing act that each department has to do. And so when we're looking at this with the probation departments, I went ahead and brought up our Texas Progressive Interventions and Sanctions Bench Manual, and we put this together and have used this quite a bit with our Judicial Advisory Council. And I would like to recognize Judge Keller, who actually sits on our Judicial Advisory Council. She's the presiding judge over the Court of Criminal Appeals. So I'm glad that she's here. But this has a lot of information for Texas. You can find it on our website, and then a lot of the things that I've been talking about are included in this bench manual, and we have a lot of judges who use this to know what resources are available in the state, and some prosecutors as well. I just wanted to mention we do have a probation advisory committee that is looking at technology. They have a subcommittee dedicated to technology and how we can advance it in the state, to look at our standards and what we're requiring of offenders, what we're requiring at the state level, but also what the departments are requiring of their offenders. And if anyone has a teenager, you can probably understand when I say that, the new generation coming up, as Mr. Nail said, it's a different generation. My son is 18. I take any kind of condolences afterwards. They'll tell you he's about to go into college, and so of course when he's applying for college and everything, he was so frustrated one day. He goes, I don't understand. I don't understand. They sent me a phone number. I'm supposed to call somebody. Why don't they know you don't call anybody anymore? Why can't they just text or email me? That doesn't make any sense. And he's going through this tirade, and I'm just looking at him thinking, you get so much done when you're talking to a person, right? So then he proceeds to tell me, not only is he supposed to call someone, they are sending something in the mail. Who gets mail anymore? anymore. I can't believe they're sending something in mail. Now I have to go check it. I've got to pay attention to the mail. I don't understand why they can't just email it to me. And I am just looking at him because he's literally like going through this tailspin. And I'm thinking, what's the big deal? I actually like talking to someone, and gosh, I still love getting mail. Not the bills, not that part of it. But you know, it is different. And so you have to think about the people who are working in the system, but you also have to think about, you know, some of the offenders who are coming up into the system, and how can we get to them? How can we communicate with them so they don't become an absconder, so that we can keep them on the right track, and again, they can be productive, tax-paying citizens of this state, and then we can increase public safety at the same time. Again, fewer victims. So I really appreciate it. I have some business cards if you'd like to take one. If you have questions later, I would, you know, be glad to take any questions. And you know, I'm always one of those people, I think about questions after I leave, you know, not when I'm there. So please feel free to give me a call, and I can talk to you about some of the things we're doing in the state. Thank you.